welcome to today's episode of the Pediatric Consult. I'm Dr. Jill Schaffeld, your host for today, and I'm excited to share with you that I'm in the studio with Dr. Stephanie Weber from Cincinnati Children's Division of Developmental and Behavioral Pediatrics. And today's episode is kind of a deeper dive into autism resources for the general pediatrician. So welcome, Dr. Weber.
Thank you for having me.
If you wouldn't mind sharing just a little bit about yourself, maybe some clinical interests you have, and just tell us a bit about your background.
Yeah, so I was trained as a clinical psychologist, and I've been practicing here at Cincinnati Children's since 2011, where I was a fellow. And then I always joke that I was getting my PhD in Netflix, so I went back and got a master's in public health as well. So I have that experience around kind of more population-based health and needs. And I do a lot of medical education with our Leadership Education in Neurodevelopmental and Related Disabilities, or LEND program. And clinically, I do only treatment, so mostly for children with autism and other developmental disabilities and co-occurring behavior disorders. And I do a lot of toilet training for kids with autism because that is often a major issue.
Absolutely. So, well, wonderful. Excited to have you here today. And it sounds like you have a great background to share some truly valuable resources with our audience. So thank you for coming in. So I had mentioned today we'll discuss just what we're referring to as kind of a deeper dive into autism resources for the general pediatrician, specifically how we as general pediatricians can assist our families and patients in navigating the diagnosis. And really, I would look at it as being a true, champion in helping these kids thrive. So we all, I think, know, when and maybe even where, although we can go a little bit into that, to refer children when we have concerns about autism. But I know one of the barriers that we often face and families face is, how long of a wait there may be to get in. We may have concerns and, we're seeing these kids every 3 to 6 months in their office for their well child checks, and a referral's placed, and it may be 6 to 9 months before we get in. And, sometimes I feel like families, as well as maybe even general pediatricians, feel a little, I don't want to say helpless, but maybe a little stuck as what can we do in the meantime to help these patients and their families?
Absolutely. And we hear this all the time for families that have gotten to us after waiting. They don't realize what they could have done in the meantime. So I kind of think about it as a rule of 4. There's 4 main things that we can encourage families to be doing, and our general pediatricians, kudos to all the things that you have to manage. It's a lot. But when it comes to development, there's things that we can share with families that they can do at home. So there's many resources, particularly for the young children, the 5 and unders. The Learn the Signs Act Early initiative through the CDC. If you just Google Learn the Signs Act Early, you get tons of free resources. They can ship hard copy materials to your homes, to your offices, as well as just printables that you can share with families that are all about developmental checklists.
Awesome. We can actually link that at the bottom of this podcast episode, so thank you for sharing that very specifically.
So I love that one. I will disclose that I am Ohio's representative for the CDC program. So it's just a wonderful initiative around building awareness for families that they can watch what their children are doing and keep track and celebrate those developmental milestones, but then act early if they have any concerns. There's a free app as well, so that's available in English and Spanish, and it corrects for prematurity. And families can just get tips and ideas on what they can do during bath time, during meal times, while they're riding in the car, what songs to sing. Parenting is hard, we know, and so any little tips and tricks that we can get and share, they're all right there at their fingertips.
And I love that. I love that it sounds like it's very parent-facing as well. We all encounter this no matter what specialty, I think, of medicine we're in, but we have a very limited time in the office, right? So having something that we can share with parents that allows them to be able to look at these things at their own pace, or maybe when these issues arise, and not just, oh goodness, what did my pediatrician say in the 15-minute appointment I had with them, trying to remember that. So that, I think that sounds like a wonderful resource.
Yep. Another resource I would say for all ages is Harvard Center for Developing Child. They've got some great resources for executive functioning, brain building strategies. It's a little more professional looking, but they do have some primers and some handouts that can be printables or be linked into families' records, and they can download them at home. But again, all really great resources for things that families can do at
Sure.
home to promote development while
And
they're
then
waiting.
maybe for us as pediatricians,
Absolutely.
right? So that sounds like a great option as well.
Yeah. So then things that they can do at home is kind of my first step. My second step is always, depending on the child's age, referring either to early intervention, the state-based early intervention program, so finding out what that is. And many pediatricians are already very well aware of that. But in many states, that only goes till age 3. And then at 3 years old, those children should be referred to their local school district. And where it gets pretty fuzzy is what to do to coach families for this. And I think the main takeaway is always encouraging families to put every request in writing. If it's not been in writing, it never happened. And once it's in writing, states have a certain number of days to respond to that request. And there's lots of great information online that we can link to and share with pediatricians that just gives the verbiage that this is exactly what to say for requesting a special education evaluation for my child. And again, that's 3 to 21, or really the 22nd birthday in most states.
Okay, great. And that would be the parent requesting, but us giving them that info and the encouragement to go ahead and
Absolutely.
make that request and hopefully help them with how
Absolutely.
that
And
would look and sound.
You've got it. And it's not necessarily the local elementary school, it's the school district. And
Okay.
district to district is very different with how they might schedule or who might be part of the team when they meet with the families. But being able to kind of give the families that anticipatory guidance that this is the process that you need to follow, and here are the resources within your state.
Absolutely.
And in a place like Ohio Department of Education has a roadmap, so it really walks families through step by step how long to expect a response or what to expect if you don't get the response you may want for your child and that type of thing.
Great, thank you. And so we were 4 steps, I believe.
Yeah, so we're
you
down to
were-
two more.
Great.
So the third step then would be any other therapies that we could get started while we wait for maybe a more comprehensive evaluation. So if a child has speech concerns, we always want to make sure we get them connected with audiology to rule out hearing issues, and then go ahead and get on the speech wait list. Or if it's something with motor or daily living, occupational therapy or physical therapy. Behavioral concerns oftentimes don't even require a physician referral. Families can self-refer to some of those community psychologists or behavioral health practices. So just getting those things going while they're waiting for an autism or other learning type of evaluation. They don't have to wait for those because they're going to do their own evaluations
Yeah.
anyway. So just get going.
I think that's a great reminder. We all realize that children who are being referred for potential autism diagnosis or developmental and behavioral problems all likely require therapy at some point. But just that kind of encouragement to say, you know what, regardless of how long you have to wait for maybe an official diagnosis to be made, this child will still require some therapy. So that push to just go ahead and not necessarily wait to see what that specialist recommends. We know they need it to go ahead and start referring to the therapy. So I just think that's a great reminder, although I don't think that what I just said was, enlightening for, I think general pediatricians know that, but I think just remembering that it doesn't always have to happen in this certain order, that we can go ahead and get them involved and get these therapies underway to start helping the patient and the family is a great, great reminder. So thank you.
Absolutely. Yeah. And I think that the other big piece is that early intervention and outpatient therapies can happen at the same time. And for many of the kids we see with significant developmental delays, that's really the best case scenario for them and their families is to be connected both to the state-based systems or, if they're over 3, to the school, but then also receiving the private therapies.
Sure. No, that's perfect. Thank you.
So
and then we're
yeah.
down to step 4, I think.
Yeah, so step 4 is really that support for families. This is a lot, especially when you have a child with any type of developmental concern. There's societal stigma, there's fear, there's pressure that families put on themselves to, be the perfect parent. And so being able to be connected with other families who have had experience with their own children, there's programs out there. And so there's something called the Family to Family Health Information Centers, and those are available in every state. They are staffed by people with lived experience of raising a child with a special healthcare need, oftentimes a developmental disability or an acquired disability. And so they can just help answer families' questions about anything health related, from insurance to, is this the right therapy for my kid right now?
Wow.
And how to prioritize. So I think that's a great resource. Those F to Fs is what they're called.
Yeah, absolutely. And, I definitely see that aspect of things as we're even discussing, sometimes even before we refer, discussing different behaviors, and, all parents are kind of at a different point of maybe even acceptance of that or just where they are in the, process of even considering these things that we're talking about. And that can be very hard for them to navigate. And sometimes it seems like we tiptoe a little bit around it too, because those are really hard and difficult things to hear. So I think that would be a huge support, not just for us as physicians to be able to tell them, but for them to be able to, like you said, connect with those other families and to also hear maybe some success stories and some things that are very positives that, this huge potential diagnosis that we may be discussing with them that, this isn't, I don't want to say it isn't all bad, but it is, that there are some very good success stories and there's some positives and
Absolutely.
there's, families that have navigated this very well and had success for their children.
And I think I love that you brought up the success stories, because there are so many families that have said, yeah, this was hard. Parenting's hard, right? We can't emphasize that enough, but when you have that network of other people who can give you advice and walk you through, and especially in the disability world, we're always making improvements. So somebody's experience 10 years ago may look very different than someone's experience tomorrow. And I think that's really great. But to hear that emotion from another parent and to know that you're validated and you're heard, that's not something that we as providers can do really for them. They got to get it within that network of other families. And so in addition to the F to Fs, there's Parent to Parent USA, and so there's also the Parent Mentoring Program. So families volunteer their time to say, I just want to give back and help other families. And so they get trained, and they can also, so families can search for other families that have had very similar experiences and get connected that way too, through Parent to Parent.
Perfect. I think I really appreciate you actually naming all these programs, because I think that's some of the hardest parts of this is just knowing that there's programs out there, but not necessarily knowing what all those programs are. So thank you for sharing very specifics. So that this has definitely been just eye-opening. I mean, there's maybe one or two of the things that you've mentioned that I've actually heard of before. So this is great that you're sharing. So hopefully, and I think that our listeners will agree. So, so kind of moving into a little bit more of, as we look on to, we talked about referring over age 3 to their school district for additional kind of intervention and help, especially, as maybe it's an older child who we're referring in for autism spectrum diagnosis. I'd like to maybe transition a bit into talking about how we can support older children in terms of resources at school. So,
Absolutely.
IEPs, any other resources or any other knowledge you have to share with us about that.
Yeah, I think it's really an area that is getting a lot of emphasis right now, especially because we know that the field of diagnosis for girls with autism, they're just diagnosed later at this point than boys typically. And so we're seeing a lot more of those girls pop up in middle school, junior high, even into adulthood. And so I think that that's really just something for general pediatricians to keep an eye out for. The kind of quality of their social interactions
that makes sense,
is different.
But I don't know that I've ever heard that statistic. So that's a great thing to bring up.
Just definitely, it's the term masking is really common in the autism world, and a lot of females that reflect back on their childhood say, gosh, I was just really good at masking, and so I could, get on with my day and not look as though I was as stressed as I was, but then I got home and just fell apart because of how stressful and overwhelming it was for all the social demands.
Yeah, I also wonder, just thinking in general about, even if we're talking about neurotypical children, males tend to have a little bit more of the behavioral outbursts than females in general.
Absolutely.
So that probably all plays into that and into the masking as well.
And the idea that we're going to pick up on externalizing disorders much more quickly than internalizing disorders too. So,
Absolutely.
So kind of back to the question then about how do we help families navigate. I think the biggest thing is helping them understand that a medical diagnosis of anything does not equate to a educational classification and does not guarantee an individualized education program or IEP. So the school has the right to do their own evaluation, and they don't have to take any of the medical evaluation results into consideration, although many school districts will, and that's very helpful to them. And they want to get those reports from the doctor or the speech therapist outside of the school district, but it's completely separate processes. And so to help families understand that it is widely different and that one does not equal the other is really, really a great first step.
That's great advice.
Mm-hmm.
In terms of, maybe we are and we've talked about this a lot, I feel like in the first half of this podcast, but maybe we're still waiting for a diagnosis, but the child is struggling in school. Yes, I feel like as a pediatrician, I can talk to families about, go to your school or go to your school district, request an evaluation for an IEP or an individualized education plan. I think you mentioned this earlier, and to circle back on this, some smart person, I believe it was a teacher at some point in my career, told me, do everything in writing. Everything in writing, absolutely. Yes, so I have in the past encouraged parents, put this request in writing. But is there anything else besides making the parent aware and telling them, you need to put this in writing? Is there anything else that I or my colleagues can do as a general pediatrician that may assist with obtaining an IEP?
I think that's a great question.
It's a hard question.
It's so hard because it is so dependent on the school districts.
Sure.
Many school districts will invite outside doctors and therapists to an IEP meeting or invite them for comment and sharing letters and evaluations as part of the evaluation, and other school districts kind of take it all on themselves. So I think it depends. I do think that if there is behavioral challenges, which we're seeing a great deal of now across all age ranges, and especially earlier than ever before, encouraging families to also specifically request a functional behavior assessment or an FBA. That is part of the process for if there's any behavioral challenges.
And that's something school would do?
The school would do that, yep.
Great.
And that could be part of an IEP, that could be separate from an IEP. But if a child is getting sent home from school every day, we want to avoid that.
Sure.
We definitely don't want kids to learn that, hey, if I just act out, I get to go home. Or I get to go see mom who's going to pick me up, or grandma, or anything. So we want to get at the root of why that behavior is happening, and that is done through a functional behavior assessment.
Perfect. I love, honestly, just you putting a name on that for us. Because if that is something, as the pediatrician, that maybe we want to write a letter or, ask the school. Again, it's an education plan. They don't have to do it, right? Mm-hmm. And like you said, some will. But it doesn't sound like it would hurt anything. And I think if we come in with a little more background knowledge and say, I think this child will really benefit from an FBA, and that may give us more information to develop an IEP for them.
And really, the biggest thing is that nobody wants to be told how to do their job,
Sure.
right? We don't in healthcare. And the school teams will always say, can you ask the doctors to stop writing prescriptions for IEPs? I'm like,
Right.
yes, okay,
Yeah.
yes. But the idea is just knowing what to ask and how to ask it,
Sure.
but it has to come from the parent, really,
Yes.
when it's for a school-age kid.
Yeah.
And school age is different when you think about special ed because it starts at 3, and we don't think about 3-year-olds being school age.
Yeah.
But it definitely, back to that FBA, getting that understanding of why a behavior is happening, when it's happening, who it's happening around, then what happens is the school should be linking the results of the FBA to a behavior improvement plan, or a BIP.
Okay.
And these are all alphabet soup that families don't
Well, and
know.
like I said, I didn't know
Yeah.
most of these.
So that's
great.
where it's helpful to encourage the families that don't just get an FBA. That's going to not be the end of it. The end of
Sure.
it is the behavior intervention plan, so that there's actual changes in the adult's behavior and in the environment for the kid to see if improvements can be made.
Sure. That's great. So any insight, that we're talking about some of these initial steps just in identifying the behavior and talking about the BIP. And I know I keep on circling back to an IEP, but any support for general pediatricians and families for maintaining IEPs? I believe, is it yearly, annually, they have to have a meeting, but some schools do it, I feel like, even more frequently than
Absolutely.
that.
Families can request an IEP meeting update in writing,
Okay.
again, whenever they feel like they need it, and then the school has the responsibility to respond. I think the other piece to keep in mind is that both the student and the parent are part of the IEP team. So they really should be feeling welcomed as part of the team and not an outsider that doesn't have an opportunity to make decisions, because they absolutely should. And our kids should participate on their IEP teams as much as they can developmentally participate.
Perfect.
I think the other piece about the IEP is that it doesn't always, a request doesn't always have to result in an IEP, but there's also 504 accommodations. And that is sometimes looked at as lesser than or not as helpful, but oftentimes kids may not require a full IEP, but the 504 accommodations could result in extra time for tests, or a quiet room to take tests, and or extra time on homework, or just more specific supports week to week. And that's great.
Yeah, that's what I was actually going to ask you, if you could tell us a little bit about the differences between those two. And I love that you gave those examples of the very specific interventions for the 504B, which can be super, super helpful. Some of those interventions can be included in an IEP as well,
Oh,
correct?
absolutely.
Okay.
Absolutely, yeah.
So maybe just for, our audience kind of learning about these two, what would you say are the main differences, and maybe when a 504, or who a 504B versus an IEP, one may be more appropriate for one person versus the other, or one family versus the other?
That's a great question.
So kind of a loaded question.
Yeah, very
So,
complex answer,
yes.
too, I would say. Well, the main difference is the federal funding. They're based on federal law, both of them, different federal law. So education is under, school-based education is under Part B of the Individuals with Disabilities Education Act, versus a 504 plan is under the Rehab Act. And so there's more federal funding under special education law, and so there's more specific adherence to that IEP than necessarily to a 504 plan.
Gotcha.
So that's a big difference. Once it's signed, it becomes a must. The school must do that. And the 504 is more of an accommodation plan. So these are things that could be helpful to the child that the school agrees to participating in to help the child learn and grow. The main difference with an IEP is that the child would be classified under one of the special education law classifications. So autism or kids with ADHD would be under other health impairment, or OHI.
Gotcha.
And so that is kind of what drives that plan to continue. And the other big thing about maintaining an IEP is that the child has to have deficits in their learning. And so we have a lot of kids potentially on the autism spectrum that get really good grades. They're really bright young people, but they don't struggle academically. And it's really challenging to say they need an IEP when they're getting all A's and B's.
Gotcha.
But yet, on the flip side, their social skills, are really at a deficit. But according to special ed law, their disability has to be impacting their academic function and educational functioning.
So therefore, a 504B would be
That could
great
be very
for
helpful.
that
Right,
group.
absolutely.
So I'm going to kind of divert a little around the side, but just all these things running through my head as you're talking,
Yeah.
which is great. And maybe I'm just trying to help our audience too. Private versus public school,
Mhm.
because, is
Great
in
question.
terms of navigating through like an IEP, is that something even a private school?
Yeah, no, private schools are not bound by the same federal law because they don't receive the same levels of federal funding as public schools. And so a public school is required to provide free and appropriate public education, or FAPE, and a private school is not required to do that. And I've had this happen even in my own family. They'll say, well, I pay all this money to go to a private school and they're not offering my child what they need. And by federal law, they're not required
They
to.
don't have to.
They don't have to.
Yep.
Yeah.
So
So that's a big difference.
Do some of them still use IEPs if you're going to a private school, or would you feel like most of the time that's more 503 for that reason, or kind of what do you see? I'm just thinking listeners and parents and,
It's a more informal accommodation plan typically. That's an
Okay.
agreement
Great.
with private school staff and families on what the child may need. And sometimes they might go back to the family and say, this is what we can offer, but this is the extent of what we can offer. And
Sure.
if your child needs more, this isn't the place for them,
Yeah.
unfortunately.
And I think that's great. We can just know those differences and know those challenges that may happen, knowing that there's probably wonderful private schools who make great accommodations for their children, but that they're not necessarily bound legally to do
Correct.
those things. So, that parents
they-
really have to be champions for their children and, understand when, one school versus another might be a good fit for them.
Absolutely, and especially
Great.
when you have multiple children and you just all want to have your kids in the
Yes,
same place.
yes,
And sometimes
absolutely.
it's just not a possibility in
Sure.
some regards.
Sure. Well, I want to thank you, Dr. Weber, for sharing all of that information with us. Definitely felt like that was super, super helpful, just, going through everything from what we can do in that waiting period for initial diagnosis and how to assist our families with navigating through some of these very tough things to talk about. So just in wrapping up, are there any other additional little pearls or things that we went over that you just thought, oh, goodness, I want to make sure that this is the big kind of point we get across, or, little tips or tricks for us as we are in closing here?
Yeah, no, it's been great being with you, being able to share this information. Hopefully it's helping, will help a lot of people better know what's available. But I think that's the biggest takeaway, is that there are lots of supports available now and new programs developing every day. Many are state-based, so it's really a matter of connecting with the state's Department of Education or Department of Developmental Disabilities. Getting kids enrolled in that early intervention program before 3 can help the families get into, quote-unquote, the system. And then those folks, that's their job, is to help families be guided through to the next step. I think the other big takeaway is anything related to working with the schools is get it in writing from the parent. An email is going to go a lot further than a brief conversation at pickup or in the car
Sure.
line. So we got to make sure everything's in writing.
Yeah, wonderful. Well, thank you, and thank you for being here today. I feel like this was lots of information, and I can't wait to go back and listen to all the specific resources that you shared with us. And then just to remind our listeners that we will, if you check the podcast, the actual episode notes, we'll have links to a lot of these resources so that you can share with your patients and families. And we appreciate everyone listening today. Thank you again, Dr. Weber.
Yeah, thanks for having me.